So we'll be starting with the history of medicine from Hippocrates to COVID-19. The history of medicine So we'll be starting with the history of medicine from Hippocrates to COVID-19. So the history of modern medicine as we know it today, it has a long and checkered history. We'll be going before Hippocrates and we'll be going beyond COVID-19, the implications of COVID-19. We'll be traveling a lot of years before the advent of Christ to the present day. So medicine, although I have titled this slide prehistoric medicine, medicine in the prehistoric times was not much scientifically developed as it is in the present day. So as the picture here suggests, medicine, there was nothing called as medicine. There were some ideas, notions, and beliefs among people. There was a lack of hygiene, which was conducive for the growth of microorganisms. There was poor knowledge about the various diseases, infection, wound care, regarding the concepts of life and death. So anything that was abnormal, anything which could not be explained properly, any disease, any illness, any sickness was attributed to supernatural powers. So here we can see a skull, a human skull with 3 holes in it. This is the first known case of trephining. Trephining is a process by which the skull is drilled, holes are created, and brain matter is taken out. Today it is done in neurosurgery to treat hematomas inside the skull when there is some sort of hemorrhage in the brain. In ancient times, people used to do this, thinking that when a person has become a lunatic, in case of psychiatric illnesses, to cure the person, they used to take out part of the brain through the skull. So this was what constituted medicine in prehistoric times. In later times also, you can see this picture, this beautiful picture. Is a painting, oil painting on canvas, showing trephining in ancient Peru, how they are taking out a part of the brain to boring a hole in the skull. So with the dawn of civilization, medicine gradually progressed. However, medicine was intertwined with supernatural thinking. There was no difference between rational science and superstition. So when a person fell ill, when disease used to occur, along with medicines, chants and incantations were also prescribed. These were thought to cure the person in totality, in its entirety. So that they were not mere doctors; they were priest doctors, people who prescribed medicines, prescribed herbs, and along with that, they also prescribed chants, incantations. And in ancient India, they used to prescribe certain so-called magical incantations, and mental illnesses were ascribed to supernatural entities, to ghosts, to the working of demons, etc. This is one of the 4 Vedas in Hindu mythology, Atharva Veda, which pays a scripture showing some portions of so-called medical science, and along with its slokas and incantations. So you can see that medicine was intertwined with supernatural notions and ideas. The same is the case in ancient Egypt. He is Imhotep, who was who was a philosopher, he was an author, he was a physician. Along with that, he was a priest, he was a magician. In later days, he came to be known as a god also. So you can see there was nothing to differentiate a doctor from a priest in those ancient times. The discovery of this papyrus in 1600 BC, the Edwin Smith papyrus, this was a landmark event in decoding the history of medicine. This papyrus, it describes 48 cases of injuries, fractures, wounds, dislocations, and tumors. So the importance of this papyrus, this document, is that it presents a rational and a scientific approach to medicine in ancient Egypt. There was an honest attempt to approach diseases through knowledge, through truth, and through science. However, even then, when doctors, so-called doctor priests, they could not explain those diseases on the basis of bodily functions, organic functions, they used to ascribe those ailments to mysterious supernatural causes. During the same time, in the same continuum, two great physicians arose in India. One of them was Charaka, the other was Sushruta. Charaka was a physician, Sushruta was a surgeon. So Charaka was one of the first physicians to present the concept of digestion, metabolism, and immunity. He gave the principle, the Tridosha principle of Vata, Kapha, and Pitta, which almost corresponded to the Western classification of humors, wind, bile, and flame. So somehow he tried to describe, though not scientifically accurate, he tried to describe a disease in terms of methodology, in terms of logic, and not just ascribing those things to supernatural phenomena. Charaka describes an ideal medical student. You can see there are elements of medical ethics here. He says that a medical student should be noble by nature, devoted to truth. He should be of good character. So these are things. These are improvements in medicine. Slowly, one by one, several things got incorporated into the science of medicine, and it developed. So these are the early beginnings. Sushruta was a great surgeon. He had an accurate anatomical knowledge of body parts. He performed an enormous number of surgical procedures, and he laid particular emphasis on dissection of the human body and understanding of the various body parts. This picture is famous worldwide as the rhinoplasty of Sushruta. It shows on one hand Sushruta performing the operation, the surgery on the nose. This is the nose of the person pre-operatively. This is what he has done. He has constructed flaps and grafts here on medical terms, and he has reconstructed the nose. And this is the post-operative picture. Look how beautiful it looks. In those days, before the advent of Christ, these things were being done. So Sushruta was a pioneer in the art of surgery. Medicine not only in India and Egypt, it also developed in China. Chinese medicine was based more on the use of herbal medicine, techniques like acupuncture and other forms of therapy, which have continued to this day also in different forms. We all know that the role of the Greco-Roman civilization in the development of humankind is pivotal. So medicine too advanced with the development of the Greco-Roman civilization. Asclepius, who was known in ancient Greece as the god of medicine, similar to Dhanvantari in Sanskrit mythology, temples were built dedicated to him, and you can see here doctors and physicians, nurses taking care of patients. Although the supernatural entity, the basis is there, here they have at least, these are comparable to modern day hospitals or hospices. Next in the line came one person who is considered to be the father of medicine. His name was Hippocrates. The advent of Hippocrates is considered to be the landmark event in the emergence of medical ethics. First, do no harm was his first teaching. The Hippocratic Oath, as we all know, that is taken by all doctors and medical professionals before they start practicing medicine. I'll not read the entire oath here, but some particular points I would like to emphasize. To hold my teacher in this art equal to my own parents. To help the sick according to my ability and judgment, but never with a view to injury and wrongdoing. To abstain from all intentional wrongdoing and harm. So these are the things. These things in those days, today these things might look very easy, very natural, but in those days, these things were revolutionary. The major achievement of Hippocrates was to systematize medicine. As you can see, a disease has got several aspects. A disease can be acute, a disease can be chronic, a disease can occur as an epidemic, a disease can be endemic to a particular area. So these terms are not modern terms. These terms were described by this particular person, Hippocrates, long back, 2000 years back. The interesting point about Hippocrates is that he stressed upon the fact that disease was not a punishment inflicted by the gods, as was believed, but it was rather the product of environmental factors, diet, and living habits. Indeed, there is not a single mention of a mystical illness in the entirety of the Hippocratic corpus. This particular aspect of Hippocrates we must emphasize, we must remember. The notion of superstition, of supernatural workings in diseases and ailments was shunned by Hippocrates. Although Hippocrates had limitations, he too believed in the theory of humorism, in the humoral theory. It must be acknowledged that he at least tried to explain diseases on the basis of organic causes. I put up some pictures here. These pictures are more of used in medical parlance. However, I'll try to emphasize the fact that the teachings of Hippocrates are valid to this day. This person, this girl, this faces is called Hippocratic faces. This faces means a person is going to die very soon. This face of a person apparently smiling is called the Hippocratic smile. It occurs in tetanus due to extreme spasm of the muscles of the mouth, of the face. These fingers, these swollen fingers, these are called Hippocratic fingers. These are found in diseases of the heart, lung, and a lot of other diseases. This is the Hippocratic bench used to treat fractures. This is the Hippocratic bandage used in treating head injuries. So these are all described by that great person 2 millennia back. Next comes in the line of great physicians, Galen. Galen was called the Prince of Medicine. His teachings had such impact that for 1500 years they were almost unchallenged and uncontested. Galen wanted to dissect human bodies. He was prohibited. He was not allowed. Prohibition was rampant in those days. The human body was considered something very sacred and could not be touched. So Galen used monkeys and pigs for dissection. He used to look for the bodies of dead gladiators who died in those fights in Rome. He was severely opposed by other physicians. He would cut upon a squealing pig. He would take a pig while it was howling. He would cut the nerve, the vocal cords, and he would prove to people, to other physicians, that the vocal cords control the making of sound. He differentiated between venous and the arterial blood and many other parts of the central nervous system. The anatomy of the lens and the cataract surgery were pioneered by Galen. So vivid were his descriptions of anatomy and physiology that his findings remained uncontested for 1500 years. We now move on to the Middle Ages. The Middle Ages are a bit dark. As we all know, history teaches us the medieval periods were one of the darkest periods in human history. In medicine too, since civilization went into decadence during those time, medicine also, there was not much work in medicine, except perhaps the rise of the Islamic civilization and Islamic medicine. So there was one Paul in Constantinople. He is considered the father of early medical books. He's noted for his accuracy in content, and he heavily influenced Arabic medicine. The rise of Islam is considered to be one of the most important milestones in human history. The Islamic upheaval also involved medicine. Anatomy, ophthalmology, pharmacy, physiology, surgery developed. Although they heavily drew upon Indian, Persian, Greek, Roman, and Byzantine medical practices, they also took these practices to greater heights. They developed newer techniques of their own, and they heavily followed Galen's work. The foremost among these was Al-Razi. He was a polymath, a physician, a philosopher, a logician, and an astronomer too. All of us who are doctors or medical students, we know that the human eye has got a direct and an indirect consensual pupillary reflex. So these are all proven, these are all discovered by Al-Razi. He is considered to be the father of pediatrics and a master chemist. The importance of Razi in the development of medicine was the fact that he stressed upon evidence-based medicine. Once he was asked to pick a hospital's location, what he did was that he suggested having fresh meat hung in various places throughout the city, and to build the hospital where the meat took longest to rot. We can see the idea behind this point, to set up the hospital in a place where the chances of infection would be the least. So Razi was really revolutionary in this regard. His description of smallpox, his means to control it, to show that smallpox is a contagious disease, one must keep away from it, these are considered revolutionary in those times. In addition, he questioned the theory of humorism of Hippocrates and Galen. Once one lesser known fake doctors whom he used to attack, he approached Razi, saying that Razi was suffering from glaucoma and his eye needed to be operated. He approached Razi, offering that he would operate on his eyes. Razi asked him the anatomy of the eye. The poor doctor, he couldn't explain. And Razi said, my eyes will not be treated by one who doesn't know the basics of his anatomy. You can see, he warned that even highly educated doctors did not have the answers to all medical problems and could not cure all sicknesses or heal every disease. So great was his awareness, so deep was his knowledge. The worthy successor to Razi was Ibn Sina, who belonged to the Islamic Golden Age. In his canons of medicine, he made concise all the observations of Galen, Hippocrates, and Razi. He summarized all medical knowledge of his times and introduced very advanced drug designing based on drug delivery, targeting the organ, deposition of a drug, the control of pain in treating patients, wound healing, etc. Nothing much can be said about Indian medicine in the Middle Ages. India was in a dark period in all aspects of philosophy, science, literature, and medicine also. Unani medicine occupies a small spot in that great diaspora of medicine during those times. Unani medicine can be considered to be an offshoot of Arabic medicine. Siddha medicine was also practiced during those times in Dravidian region in southern India. So after this period of lull, this period when nothing much was being done except from accepting Islamic medicine, we are now approaching that period in medical history when the period of Renaissance starts to appear. One of the towering figures in those times was Mondino di Luzzi of Italy. He is widely considered to be the restorer of anatomy. He declared human beings are superior to all other creatures because of their intellect, reasoning ability, tool-making abilities, and upright stature. Because he possesses these noble qualities, man is worthy to be studied. This was his declaration. With the beginning of Renaissance, medicine started freeing itself from the shackles of religion of the church. Three figures I have shown here. These three figures represent three important contributions to medicine. Number one, this is the human arm, which shows this is a figure from the notes of William Harvey describing human circulation. The second figure is the first microscope discovered by Anton van Leeuwenhoek. The third figure is of a human body, a human cadaver dissected by Andreas Vesalius. Dissection of a human cadaver was unthinkable in earlier times. Vesalius, who can be considered to be a rebel in medicine, he did this. He corrected 200 mistakes of Galen, Andreas Vesalius, so much that he was antagonized by all physicians of his times. His property was confiscated. He was sent to exile. He was dishonored. Even then, he continued doing what he did best. This is a slightly more complex picture. I hope everyone understands it. We all know that the heart is a source of blood in the human body. This is the heart here. This is the extreme right picture here. This is the modern system of circulation of the human heart. So the heart, all the blood goes out to the heart. From the right side of the heart, the venous blood comes to the right side, then goes to the lungs. From the lungs, it gets purified, comes to the left side. From here, it goes to different organs. This is the modern concept. Look at Galen's concept. Galen thought the liver is the source of the blood. All the blood comes to the heart. From the heart, there is intermixing of blood, and then blood goes to different organs. So, according to Galen, there must have been certain connection between the right and the left side of the heart. Now look at the thing. Look what are the lessons from history. For 1400 years, anatomists claimed to find that these holes existed. Vesalius said he could not find them. Just because he said there were no holes, attacks continued on Vesalius. He was sent to exile. An article was published that claimed that the human body itself had changed since Galen had studied it. You can see, to suppress a new voice, to quell a revolution, to quell a claim that is new, that is novel, people can go to any extent, authorities can go to any extent. These are lessons from history that we must remember. William Harvey was a great crusader. He rejected Galen's views on the primacy of liver as the center of circulation. He established the process of circulation in the human body. He was one of the examiners of 4 women from Lancashire who were accused of witchcraft during those days. And as a consequence of his report, all of them were acquitted. The statue of the bust that you see here is of Paracelsus, who is considered to be the stormy petrel of medicine. He criticized all physicians of his times. He publicly criticized Galen and Avicenna, disproved their theories, dissected human bodies, declared that the patients are the textbook, the sick bed is your study. You cannot study in the candlelight at your room in the comforts. You have to study at the sick bed with the patients. For this reason, he was compared to Martin Luther, who was another, who was again tortured. And he said, I'll be responsible for what I say. That which you wish to Luther, you also wish to me. He wishes both in fire. This was Paracelsus, the revolutionary. The contributions of Leonardo da Vinci and Michelangelo cannot be negated. Although they used their dissections primarily for paintings to understand the human body, for drawing for sculpting figures, the precise way, the precise mechanism with which they described in detail the muscles, the bones, the nerves, the sinews, this helped in understanding the anatomy of the human body a lot more. It made it a lot more easier. The development of schools came much later. The first medical schools started in the 9th century. The universities of Padua and Bologna were one of the earliest universities. However, medical schools as we see today were not much developed in those times. Edinburgh in Scotland produced a number of medical graduates, but they were not systematized. Coming to modern medicine constitutes of two parts. One is basic sciences, the other is clinical medicine. Basic sciences comprises of the various achievements, developments in natural sciences, in biology, in understanding the human body, and clinical medicine is the applied aspect of those basic sciences. So it can be said to begin with the proposition of the cell theory by Theodor Schwann, who said that human bodies or living organisms consist of cells. The discovery of the microscope prior to this by Leeuwenhoek helped in this. That cells constituted tissues went on to form organs and organ systems, and then the living organism. Various parts of the cells, like the Golgi apparatus, like the mitochondria, like the nucleus, were described by different scientists with the help of the microscope. These all helped consolidate the various discoveries, various forms of knowledge till that time. Next came Robert Koch, who was considered to be the father of microbiology. Koch's postulates, the four postulates that he proposed, are relevant to this day. Whenever we say that an organism causes a disease, whenever we say that coronavirus causes COVID-19, or whenever we say Mycobacterium tuberculosis causes the disease called tuberculosis, we cannot say it just for the sake of saying it. There must be some logical reason. So these are summed up in these four statements. These are given by Robert Koch for the first time. This is called Koch's postulates. A microorganism must be observed in every case of the disease. It must be isolated and grown in pure culture. The pure culture, when inoculated in animals, must reproduce the disease. A microorganism must be recovered from the diseased animal. So this is the logical methodology, logical systematic approach. Only after this one can say that this disease is associated with this particular organism. So you can see the rigorous approach, the rigorous methodical approach that is required in medicine to establish the cause and the effect. We all know about Louis Pasteur. There is nothing more to say about this great man, who was the father of germ theory, who developed the rabies vaccine. In fact, it was Louis Pasteur who consolidated the fact that the origin of life doesn't come from any supernatural entity. Along with other scientists of this era, his germ theory proved to be very essential in helping in dispelling the notions of supernatural and superstitious thinking from medical science. Edward Jenner, the father of vaccination, who vaccinated his own child against smallpox, who vaccinated himself against smallpox, they all played major roles, great roles. They made huge sacrifices in helping medicine progress. Similar is the case with Paul Ehrlich, who is considered to be the pioneer in immunology and in chemotherapy. Many of the drugs that we use today, many of our beliefs, concepts regarding the immune system can be ascribed to Paul Ehrlich. Now, all these advancements in medical science were helped by two people. One was Charles Darwin by his theory of evolution. The theory of evolution by Darwin practically changed the way humans looked at the existence of life on Earth. Where we come from, what is our origins, how human history has changed can all be ascribed to the findings of this great man. Look at this picture. You can see how Darwin is caricatured as a chimpanzee. This was how the press attacked him. This was how the church attacked him. This was how the authorities attacked him. And this person, Gregor Johann Mendel, despite being a priest, despite remaining in the confines of the church, despite being made to follow religion blindly, he made those stupendous discoveries. He discovered the laws of genetics. So genetics and evolution, two major discoveries of this era, of our era, they help develop medical science to greater heights. This great lady, Madame Marie Curie, by his discovery of radium, brought in a different dimension to medical science, the dimension of imaging, of X-rays. Today, an X-ray, a CT scan, a PET CT scan, these just child's play. These are all started. This person, Marie Curie, she died of leukemia due to the exposure to radioactive effects of radium. So when we read history, when you see history, when you delve into history of anything, and in this case in the history of medical science, we must remember the achievements as well as the sacrifices made by people over the years. And what we are today is the result of all those sacrifices. Simultaneous to the progress in basic sciences, clinical medicine also improved. You can see these are the models of the first stethoscopes. This person is sitting there, he's a pioneer of medical science. He's Dr. René Théophile Lanac. So Lanac invented the first stethoscope. He found it extremely difficult to auscultate, rather to hear the heart sounds. He used a roll of paper, listened to it. He found the paper was cumbersome. Next, he used a wooden object. Next, metallic object. And today, a stethoscope is so easy for us. We find a stethoscope everywhere. At one time, it was inconceivable to listen to the heart sounds, the different sounds produced in the lungs, different parts of the bodies. It was Laennec who pioneered the use of stethoscope. A word about Ignaz Semmelweis. Today, during the COVID-19 pandemic, people all over the world are shouting regarding hand hygiene. If you do not wash your hands, you are not supposed to greet another. You are not supposed to shake hands with another fellow. So suddenly, hand hygiene has taken the upper hand. This person who lived in the 19th century, Ignaz Semmelweis, he proved it scientifically that washing hands decreased significantly the mortality among women who had just delivered, that is postpartum women. Just because he said that doctors should wash their hands, nurses should wash their hands, fellow doctors made fun of him, and he was considered to be a lunatic, and he was confined to an asylum, a mental asylum, where he died. Can you imagine? The person who for the first time said that hand hygiene should be taught in all medical schools, should be emphasized upon, was confined to an insane asylum because he said so. Just because he said that doctors are not gods, they should wash their hands. He was confined to an asylum. And today the whole world is shouting about hand hygiene. So history is replete with many such instances of injustice done to such great pioneers. In the field of psychiatry too, prior to Philippe Pinel, who was a great psychiatrist in France, psychiatric patients were chained like dogs and cats. Look at this picture, at this painting. A psychiatric patient, a lady here, an old man here, they're all chained. They were treated lesser than animals. They were not even properly fed or groomed. And Pinel came and unchained them. And Pinel was considered to be a savior. He showed for the first time that they are not lunatics. They have problems. They are patients. Their disease can be explained. They can be cured. That was the contribution of Philippe Pinel. In Russia, Ivan Pavlov conducted his famous neurophysiological experiment regarding conditioned and unconditioned reflex. This helped a lot in understanding the neural responses, in understanding various reflexes of the spinal cord, of the peripheral nervous system, of the central nervous system. Somewhere in India, Ronald Russ was running after mosquitoes, trying to prove that mosquitoes caused malaria. Malaria was a disease that caused millions of deaths in India. Ronald Ross, with a broken microscope in a broken library somewhere in the state of West Bengal, in a broken chamber, totally devastated by administrative apathy, by lack of help, lack of funding, made this important discovery that malaria is conveyed by the bite of a mosquito. And he was awarded the Nobel Prize later. Four figures sitting here: William Osler, William Halsted, Kelly, and Welch, the founders of modern medicine. They founded the Johns Hopkins School of Medicine in USA, which is a great institute in today's world. Prior to them, today when we enter a medical college or a medical school, we find that professors are giving rounds. Students are following the professors. They're examining the patient's bedside. These practices were not there earlier. These practices were started by William Osler. You can see here a patient is being operated upon. He is being examined. Students are surrounding the professors. This professor is explaining them. So this is the modern way of medical teaching. These are called rounds. So this all started in Johns Hopkins Medical College by these people. His famous statement, "Who studies medicine without books sails an uncharted sea, but he who studies medicine without patience doesn't go to sea at all." This is the these are some of the major achievements, or you can say contributions, of William Osler to the field of clinical medicine. 1918, the Spanish flu occurred. What we are seeing today in COVID-19, the Spanish flu was 20 or 30 times more lethal than this pandemic. Millions of people died. The population of Europe was wiped out, and mankind and humanity and medical science learned some important lessons. These are the first ventilators. You can see these are called iron lungs. Patients who had died of respiratory illness, patients who were dying of polio, which caused respiratory illness, were treated in these ventilators. So these are the baby steps that medicine was taking. Interventional medicine was taking. Ventilators were coming up. Fleming suddenly came up with his antibiotics. Antibiotics today, whenever we suffer from any cough or cold, anyone has got a stomach ache, a stomach problem, loose stools, an antibiotic comes at the drop of a hat. We go to the pharmacy, we buy some antibiotics, hardly cost 40-50 rupees, and we bring and take it. Antibiotics prior to 1945 was inconceivable. There was no notion of antibiotics. People used to die of minor infections. We must always be grateful to Dr. Alexander Fleming for this important discovery. 1921, insulin was discovered. Frederick Banting, along with his student MacLeod, along with student Best and his co-associate MacLeod, these three people, they discovered insulin. Today, insulin is panacea to many problems in diabetes. It is the drug for diabetes mellitus. And when he was asked regarding patenting insulin, he says, "Insulin belongs to the world, not to me." That was Frederick Banting. Similarly, Jonas Salk, who was the first one who invented the polio vaccine, the injectable polio vaccine. When he was asked who owned the patent to it, he said, "Well, the people, I would say. There is no patent. Could you patent the sun?" That was the greatness of Jonas Salk. So many people died of polio. Today, polio is eradicated in India. Polio is eliminated in many countries. This has all been possible to these vaccines that were discovered by Salk. One person is lesser known. His name was Subba Rao. He was almost dying on the streets of America because of poverty, due to administrative apathy and academic rejection. Many of the chemotherapeutic drugs that we use in cancer in today's world would not have been made possible, that discovery, had there been no Subba Rao. We come to one interesting character in the history of medicine, Dr. Norman Bethel. He started his life in Canada, ended his life in China. You can see this picture is in Montreal. The picture on the left is in Montreal. The picture in the right is in China. Look at his health here and his health here. He's tattered. This doctor, who was a pioneer in cardiothoracic surgery, fought at the front lines of war battles in China, in the Sino-Japanese War, under the leadership of Mao Zedong, saving thousands of lives, risking his own life, and ultimately dying of septicemia. The contribution of Bethel, apart from his pioneering achievements in cardiothoracic surgery and war medicine, was that He took medical ethics, he redefined medical ethics completely. Look at what he says. Let us take the profit, the private economic profit out of medicine and purify our profession of rapacious individualism. Let us make it disgraceful to enrich ourselves at the expense of the miseries of our fellow men. Let us redefine medical ethics, not as a code of professional etiquette between doctors, but as a code of fundamental morality and justice between medicine and the people. Let us go to the people. This was his clarion call. Medicine, as we are practicing it, is a luxury trade. We are selling bread at the price of jewels. Let us say to the people, not how much have you got, but how best can we serve you. Today, medicine has reached stratospheric heights. There is an MRI machine which can scan the whole body in minutes. This robotic surgery where there is no need for any surgeon, any physician to perform an operation. This is the imaging of the brain. Which part of the brain is functioning, how much can be determined by imaging techniques called SPECT, position emission tomography. The contribution of women in medicine was absolutely almost nil till the Renaissance. The Renaissance ushered in women to the field of medicine. Their role was still more religious and less scientific until perhaps the advance of Florence Nightingale during the Crimean War. Nightingale was not just the lady with the lamp, she was an astute statistician. She was an astute clinician. More than being just a nurse, she was a pioneer in medicine. So, having gone through the history of medicine, in short, in brief, what do we say? Is medicine an art or medicine is a science? As William Osler said, medicine is a science of uncertainty and an art of probability. The artistic nature of medicine shall always remain. Medicine is always an art. The healing touch of a doctor, the words of a doctor, soothing words of a doctor will always remain. But in the era of modern civilization, where science has progressed tremendously, you must remember that the concept of medicine has also changed. 100 years back, 50 years back, the opinion of a single doctor perhaps mattered. It was called an expert opinion. Nowadays that has changed. This is a pyramid which shows that modern medicine has changed from an expert opinion based to an evidence based. So if today I say that a particular drug is helpful in treating COVID-19, in treating coronavirus, then it may be an expert opinion of mine, but it doesn't hold any fort, any ground in the hierarchy of medical evidence. That expert opinion has to be validated in multiple case reports or case series. There has to be case control studies. There has to be randomized control trials. I don't want to go into the details, the technicalities of these things, but simply speaking, a randomized control trial means multiple number of studies in multiple number of locations involving multiple number of patients of different different ethnicities has to be done, to be tried to find out the universality of the drug. Multiple meta-analysis has to be done to ultimately prove that a particular drug is effective for a particular disease. So ultimately, as someone said, the principle upon which the fight against disease should be based is the creation of a robust body. But it is not the creation of a robust body by the artistic work of a doctor upon a weak organism. Rather, the creation of a robust body with the work of the whole collectivity, upon the entire social collectivity. What I want to mean is that the medical science cannot be alienated from the existing socio-economic system. We must understand the existing system which is operating in our country, in the world, under which medical science and, so to speak, all other sciences are operating. As Norman Bethune said, behind all stands the terrible, implacable god of business and blood, whose name is profit. Money, like an insatiable Moloch, demands its interest, its return, and will stop at nothing, not even the murder of millions to satisfy its greed. Behind the army stand the militarists, behind the militarists stand finance capital and the capitalists, brothers in blood, companions in crime. We must remember these are the circumstances under which modern medicine is operating. So therefore, are modern medical innovations within the reach of the masses? Let me give a small example. Suppose there is a person with diabetes. We call it type 2 diabetes. Diabetes I have taken as an example because it is very common in modern world. So a diabetic person invariably, definitely has got complications. He can have involvement of the nerves, which we call neuropathy. He can involve, the kidneys can get involved, which we call nephropathy, and the blood vessels and the heart can be involved, which we call vasculopathy. So supposing a patient has got neuropathy, you will need investigations. You will need an NCS, an MRI. If has got kidney involvement, you will need imaging, you will need markers. Then for blood vessels, heart, you will need a cardiac workup and an angiography, etc. The treatment aspect is there: medications, physiotherapy, a dialysis, renal transplant, kidney transplant, angioplasty, cardiac transplant, etc. So you can see this is how a single disease of diabetes with multi-dimensional complications can lead a patient to so much of comorbidity and complications. So in our present setup, as we have already discussed, the way the system is operating, where health and education are not at all free, where the people have to bear the cost of health and education, how much will this cost? We must always keep that in mind. I'm a doctor in my chamber sitting, a patient comes to me, I prescribe all these investigations, all these treatment protocols to the patient. And next, this is the economic disparity in India. The poverty threshold for rural areas was fixed at 32 per day and for urban is 47 rupees per day. This is grossly less. 32 rupees per day is the poverty threshold for India according to the Rangarajan Committee of 2014. Even under such grossly low numbers, the poverty line, the population below the poverty line was 38.2%. So coming back to this slide, I prescribed these medications, these investigations to my patient. How many of the patients are being able, will be able to do these investigations, take these medications, and become cured? Is it really possible? This is the question that should plague every doctor's mind. Diagnosis of a disease is not the end point. The end point is the satisfaction of the patient, the cure of the patient. Is it possible in such a scenario? The role of medicine during the Second World War exposed another grim face of medicine: the crimes against humanity which occurred in Nazi rule in Germany. Medicine was used, human experiments were done rampantly, and many patients, many people, they suffered, especially the Jews, they suffered like anything. So many of the diseases that we know, many of the manifestations of the diseases, they were done experimentally, induced experiments on these people. We must remember this fact, that medicine can be turned into medicine, and for that matter any other science can be turned into a tool in the hands of the fascist class to suppress or to take undue advantage for their own benefit. Coming to the COVID-19 story, I will not go into the details of pathophysiology of COVID-19. Just a few points. It is a newly discovered virus which gains entry to the cell to various receptors. I will not go into the details of all these things. Just the main emphasis I would like to say is that it has got a very complex and a different pathophysiological processes. There are multiple mechanisms, there are multiple in pathways that are involved in the pathophysiology of this disease. What is known till today, due to a large number of experiments have been done, number of studies have been conducted, and different facts and figures regarding this particular virus have been understood. So this slide is a highly scientific slide. I am not going to describe this. Just I am showing that you see the number of molecules here. Just count the number of molecules here that is there in this slide. These are all different pathways through which the COVID-19 virus is acting, and the number of drugs, number of medications, number of treatment options that can be developed. So this is another slide showing the same mechanism, some pathways. So on the basis of this, we gather that coronavirus disease 19 is a complex disease with highly complex pathophysiological mechanisms for which number of drugs, medications are being trialed. Under these circumstances, look at this piece of news item. The Indian Council of Medical Research has decided not to go ahead with the proposals forwarded by the Jal Shakti Ministry to undertake clinical studies for treatment of COVID-19 patients with Ganga water. So, the purpose of knowing history is this. The purpose of knowing the scientific methodology based upon which medical history has developed over the ages is particularly this. The Jal Shakti Ministry proposes that Ganga Jal be used for COVID-19 treatment. Just ponder, where does Ganga Jal come in these pathophysiological mechanisms? Where is the role of Gangajal in this pathophysical mechanisms? So it is my fervent appeal to all medical students, to all doctors, to the members of the general public, that medical science has got a highly complex, highly checkered past based upon trial and error with a huge number of sacrifices just to find out the correct scientific method and approach. So these kind of proposals, this kind of behavior of the government reeks of extreme degree of unscientific approach that is designed to mislead people and create an unscientific atmosphere in this country. As one great philosopher of this age said, in the field of philosophy and culture, fascism is a peculiar fusion of modern science and spiritualism. Extending or extrapolating that to the field of medicine, one can also say that in the field of medicine, fascism is being used as a peculiar fusion of science and spiritualism to mislead people. On one hand, you see a huge number of migrant workers standing in queues, standing in lines. On the other hand, you see the elite and the rich ringing bells from the rooftop, the sea beach. Do you think COVID 19 can be stopped in this manner? Do you think the community transmission can be broken in this manner? These people who are homeless, who are foodless, who are shelterless, who are moving around in this manner. Is it humanly possible? Does it not expose a flawed system? How can the diagnosis, the treatment, and prevention be different for the rich and the poor? Is it scientifically possible to control the pandemic without addressing this pertinent issue? These are questions regarding which we must ponder. On one hand, you see doctors, healthcare professionals, they're being showered with flowers. The other hand, you see a doctor doesn't get a proper place to for burial of his body. So pathetic. The distortion of history is being constantly being done. Look at this news item. The Indian Prime Minister claims genetic science existed in ancient times. He gives examples of Karna and Ganesh to support view that cosmetic surgery and reproductive genetics used thousands of years ago. The entire history of medicine has no place for such blasphemous statements. The entire history of medicine has no place for such unscientific thoughts. We must be highly aware of this. Regarding the violence on healthcare workers, this is also part of medical history. I would say it is the ignorance of the historical perspective. The people are not to be blamed. The system is a flawed system, a corrupt system, its hatred and degradation. The corporatization of medicine, the commodification of medicine has to stop. We must remember that medicine is not just a mere profession, medicine is a calling. Ethics and morality is of utmost importance. People have to be made understood. We must take the thinking to people, the proper scientific thinking to people, as Norman Bethune said. Finally, I would conclude by a few words. The function of the artist is to disturb. Doctors are artists. Doctors are one of the greatest artists. The function of the artist is to disturb. His duty is to arouse the sleeper, to shake the complacent pillars of the world. He reminds the world of its dark ancestry and shows the world its present and points the way to its new birth. He is at once the product and the preceptor of his times. As doctors, it's our bounden duty. We can't just read and pass and get our degree and practice. We must. The purpose of this organization of this seminar by Medical Service Center was to impress upon us the the historical burden, the historical perspective that we are carrying. We need to carry. The history of medicine is very deep. The history of medicine is a history mired with bloodshed, tears, sacrifice, and toil. It seems very easy for us to practice medicine today. It was not so 1,000 years back. We carry that legacy in us. As doctors, as students of medicine, it is our bounden duty to carry that legacy forward. We cannot allow unscientific elements to pollute medicine. We cannot allow unscientific elements to distort medicine. We must remember the socio-economic position we are in. We must try to change it. Because in order to set the house of medicine correct, in order to advance medicine in the proper way, in its due course, we must be deeply aware of the socio-economic changes and we must try to bring in social transformation. With this, I conclude.
Sir, এতে সেকেন্ড পরে আসছে
সেকেন্ড পরে আসছে না ମୋ ଫୋନ ନା ସେଟା
ହଁ
এটা ନେটଟା ସ୍ଲୋ
ଓ ସେମିତି ତମେ ସେମ୍ ଟା ଲଗେଇ ନେଇକି
ନାଇଁ ଏ